Welcome to the embryonic stages of orofacial development by Leslie, Marilyn, and Harris. Okay, so there are many structures that support the teeth and allow for functions such as speaking and chewing. We'll discuss the orofacial embryological development happening from weeks 4 through 12, including the upper and lower jaws, the palate, and the tongue. At the 4th week of prenatal development during the embryonic stage is when the beginning of orofacial development starts. As the embryo grows, prominences arise from embryonic layers as bulges of tissue seen here. The two mandibular process inferior to the primitive mouth or stomidium grow, and the membrane, one separating the primitive mouth and primitive pharynx, disintegrates, allowing communication with the amniotic fluid surrounding the embryo. With the oropharyngeal membrane disintegrated, the stomidium can increase in depth and widen. The two mandibular prominences fuse. The mandibular symphysis demarcates the area of fusion. The two fused structures, now the mandibular arch, will give rise to the lower lip, face, mandible, and associated tissue. With the continued growth of the mandibular process, two adjacent swelling form on each side of the stomidium. These are the maxillary processes. Okay, so proliferation allows for growth and development of the upper lip after fusion with the crescent roll-shaped medial nasal processes. The medial nasal processes form the intermaxillary segment and demarcate the fusion between the three prominences at the philtrum of the lip. Here's a glimpse into the future, but in the meantime, let's look internally at the formation of the palate.
In order to understand palate development, we need to understand that it's broken up into three different categories. The primary palate from the 5th to 6th week, the secondary palate from the 6th to 12th week, and the palate completion at the 12th week, where everything fuses together. The intermaxillary segment forms at the 5th week of formation, and it looks like a wedge shape. It's going to occur right here, and it serves as a partial floor to the nasal cavity and the nasal septum. This is going to lead to the primary palate, and at this point the primary palate is going to be separated by the oral cavity and the nasal cavity. The primary palate will develop into the premaxillary part of the maxilla, which is referred to as the anterior 1/3 portion of the hard palate. The incisive foramen is a smaller part of the hard palate where the maxillary anterior teeth are, which is going to be right here. The bilateral maxillary processes is what gives rise to the palatal shelves, which will help form the tongue. The tongue muscles begin to form, so there's going to be limited movement during the 8th week. As the palate shelves begin to grow, elongate, and move medial, here they're going to form the secondary palate formation. The secondary palate will give rise to the posterior 2/3 of the hard palate, where the maxillary canines and molars can be found. The secondary palate will give rise to the soft palate and the uvula. Now the median palatine will become well defined, which is going to be a good indication that the palatal shelves have now fused. The posterior part of the primary palate meets the secondary palate, and they fuse to form the hard and soft palate. Mature cavity separates from the nasal cavity and start to develop into the nasal septum. The palatal muscles also form, which allow for swallowing and speech. To summarize, the palatal shelves form, then the palatal shelves will elevate, and the fusion of the primary and secondary palates form the definitive palate. When the palatal shelves don't fuse in the primary palate, we will see results of cleft palate as displayed here.
The tongue is one of the essential structures, and any disturbances can affect the quality of life. Tongue development is during the 4th and 8th week of prenatal development and originates from the swellings located on the primitive pharynx, formed only by the first 4 brachial arches. At the 4th week, the development begins with the growth of a median swelling from the first pharyngeal arch. It is a triangular in shape, and it is called a tuberculum in pair. Later, as the 5th week approaches, we'll see the two oval shaping swellings, known as the lateral lingual swellings, will appear. They will develop on each side of the tuberculum in pair, still within the first brachial arch. As the two lateral lingual swellings increase in size, they eventually merge and encompass the disappearing tuberculum in pair, as shown in the picture. This merging leads to the formation of the anterior 2/3 of the tongue, also known as the body of the tongue. Next, the development of the base of the tongue begins with the swellings located immediately posterior to the anterior swelling, known as the copula. They are located at the 3rd brachial arch. Eventually, they grow and overgrow the 2nd brachial arch, or the hyoid arch. This process forms the posterior 1/3 of the tongue, or the base of the tongue. Moving on, immediately posterior to the copula is the projection of a 3rd medial swelling. This swelling marks the development of the most posterior portion of the tongue, and it's called an epiglottis swelling. This will also be your future epiglottis. And finally, completion of the tongue development occurs during the 8th week, and it consists of the cupula of the tongue fully overgrowing to the second brachial arch, and it begins to merge with the anterior swellings from the first brachial arch. Eventually, they fuse, and this is demarcated by the sulcus terminalis, an inverted V-shaped groove marking located between the base of the tongue and the body of the tongue. It's pointing towards the foramen cecum, a small pit depression, which is the beginning of the thyroglossal duct, and it is a pathway for the thyroglossal glands to migrate into the neck region. The fusion, we can see here also, the fusion of the two lateral swellings is demarcated by a median lingual sulcus. And this is how the tongue is developed. This concludes our presentation. Thank you so much for listening.